According to the Centers for Disease Control and Prevention, tobacco use is the leading cause of preventable disease, disability, and death in society today. In fact, more Americans die from tobacco-related illness than from AIDS, drug and alcohol abuse, car accidents, and homicides combined. Cigarette smoke contains over 4,000 chemicals, many of which are toxic and/or carcinogenic or cancer-causing. These include nicotine, tar, carbon monoxide, formaldehyde, ammonia, hydrogen cyanide, arsenic, and DDT, among others. The CDC states that these chemicals harm nearly every organ of the body. Indeed, the list of health risks associated with tobacco use is quite lengthy. One of the most well-known diseases associated with smoking or chewing tobacco is cancer. The carcinogenic chemicals found in tobacco have been associated with leukemia, as well as cancer of the lungs, mouth, larynx, esophagus, liver, pancreas, kidneys, bladder, and cervix, and others. Tobacco use is also associated with chronic diseases like stroke, coronary heart disease, Alzheimer's disease, type 2 diabetes, cataracts, tooth and gum disease, lung diseases like COPD, bronchitis, and emphysema, and even sexual impotence, infertility, and complications with pregnancy. The risks of smoking are not only limited to those who choose to use tobacco themselves. Those individuals who have the misfortune of being exposed to secondhand smoke, especially children, run the risk of developing asthma, cancer, respiratory and ear infections, and infants exposed to secondhand smoke become more susceptible to sudden infant death syndrome. Certainly, using tobacco comes at a high cost to your body, but beyond the health risks are the additional monetary costs to tobacco use. Smoking cigarettes is a terribly expensive habit. The average cost of a pack of cigarettes in the U.S. is $7.26. If a person smokes one pack of cigarettes per day, they will spend an average of over $50 per week and about $2,650 per year on cigarettes. The lifetime cost of cigarettes varies greatly, depending on the age a person begins smoking and how long they live, but the average smoker in the U.S. spends between $1 and $2 million on cigarettes in their lifetime. In addition to the direct cost of cigarettes and other forms of tobacco, statistics show that a significant wage gap exists between smokers and non-smokers. The average smoker earns over $3,000 less per year than non-smokers of the same background. That can add up to a loss of over $100,000 during the course of a career. Smoking also costs huge amounts of money in medical bills. Each year, smoking-related illnesses account for over $96 billion in healthcare expenditures in the U.S. alone. That boils down to about an extra $5 per pack of cigarettes to cover the cost of smoking-related illnesses. Because of the high medical costs associated with smoking, smokers also pay on average 15 to 20% more in insurance premiums than non-smokers. As you can see, the costs of tobacco use really add up. Given the financial burden and the deterioration of health that goes along with smoking and chewing tobacco, it can be difficult to understand why anyone would continue or even begin using tobacco in the first place. Images on TV and in movies and magazines can make smoking look cool or glamorous. The tobacco industry spends over $18 million every day on marketing designed to make smoking look good. Because of the addictive nature of tobacco products, the industry knows that if they can get someone hooked at a young age, they stand a good chance of keeping them as a customer for a lifetime. It's important to be a critical consumer of the media and not to be fooled by the tobacco industry. Peer pressure can also play a big role in a young person's decision to begin smoking. Teenagers may hear, "Come on, try it. Everyone's doing it." It is important to note, however, that in no age group are smokers in the majority. Anyone who says everyone's doing it is mistaken. Smokers are, in fact, a minority. Teens who have parents who smoke, or whose parents allow them to smoke at home, are also more likely to be smokers. Strong smoking restrictions at home and in public places like schools, shopping malls, and restaurants often translate to populations with lower smoking rates. For these reasons and others, more than 3,900 teens in the United States become established smokers each day. The nicotine in tobacco makes this habit extremely addictive, so unfortunately, quitting is very difficult. According to a study analyzed by the CDC in 2010, 68% of adult smokers wanted to quit, and 52% had made an attempt to quit in the past year. However, only 6% were actually successful in quitting. These statistics alone prove how difficult it is to stop smoking. But if a person is able to quit, the health benefits are almost immediate. Just 20 minutes after quitting, the heart rate drops to a normal level. 2 hours after quitting, blood pressure reduces to normal levels, and blood circulation improves. At this point in time, nicotine withdrawal symptoms begin, including intense cravings, anxiety, sleep disruption, and increased appetite. An individual who can resist the urge to light up again will continue to experience health benefits. Only 12 hours after quitting, the levels of toxic carbon monoxide in the blood decrease and oxygen levels increase to normal. After 24 hours, the risk for coronary artery disease and heart attack begins to reduce. 2 days after quitting smoking, nerve endings in the mouth and nose start to regrow, and the sense of smell and taste improves. 3 days after quitting, the body has completely rid itself of nicotine. This means that nicotine withdrawal will peak at this point, and quitting will become especially difficult. Symptoms may include headaches, nausea, cramps, sweating, anxiety, irritability, and depression. 2 to 3 weeks after quitting, withdrawal symptoms begin to subside. Blood circulation and heart function increase significantly, and lungs may begin to clear so exercise is possible without the sensation of being winded. After 1 month without cigarettes, the lungs have repaired themselves enough to be more efficient at fighting infection. After 9 months, withdrawal symptoms will be completely gone. 1 year after quitting, the risk of heart disease is half that of an active smoker. Far easier than quitting smoking is simply not starting in the first place. If you are faced with this decision, be sure to weigh the costs to your health and your bank account. Certainly, the benefits of tobacco use are few, if there are any benefits at all. Using tobacco is one of the most detrimental things you can do for your health and well-being. If you or your loved ones smoke or chew tobacco, Do your best to quit and encourage others to quit as well. If you don't use tobacco, keep it that way. Staying tobacco-free will help you to lead a long and healthy life.